Good afternoon. We're with Cory from Mercy Health, St. Rita's.
Yes.
So, Cory, why don't you tell us a little bit about who you are and what you actually do at Mercy Health?
My name is Cory Werts. I'm the Chief Nursing Officer at St. Rita's. So I am at the executive level responsible for the nursing services throughout the entire organization. I've been with the organization for 17 years since I graduated nursing school as a baby nurse back in 2001. Absolutely love the organization. Can't imagine working anywhere else.
Cory, you must have started when you were 10. You don't look old enough to have 17 years of experience. When you were in high school, did you have any idea that this is what you wanted to do?
Absolutely, I did. So I actually knew I wanted to work at St. Rita's since I was in the second grade. I remember visiting my grandmother there when she was ill, and I watched the nurses work. And as I was watching, I have a very vivid memory as I was watching them work, how awesome what they were doing. It hooked me from the very moment I was in the second grade. And so in high school, I knew that's the path I was going to take. I actually worked as a state tested nurse's aide at then it was Delphus Memorial Home, if you remember, it's now Van Crest. And so I took that nursing path and knew right off the bat I wanted to be a nurse.
So, what kind of skill sets do you need to have if you're a nurse?
I think the number one skill set is you have to love people and you have to love to serve people. That is above all, hands down, the number one thing that has to drive you internally. Other things that you need to be able to know, of course, are lots of multitasking, ensuring things like. Let me think here. Certainly multitasking and ensuring that you're able to deliver that quality care by coordinating with other individuals. So excellent communication skills.
Very good. And I'm sure multitasking is a big deal. And when you're in the nurses field today, as opposed to when you first started out, has there been a lot of changes?
Absolutely has been a lot of changes. Nursing continues to grow and evolve. And we get better at what we do. And so we learn from what we did yesterday and make it better tomorrow. And we use evidence-based practice as part of that. So the evidence that we have from yesterday is what we use to make our practice better the next day. Some of the changes include probably we've moved further away from I think the vision of nursing used to be the handmaid or extension of the physician. We've really moved into owning our own nursing practice and using our own interventions to help the patients. So.
Sounds awesome. If you're a high school student and you think you want to go down that career path, what kind of areas of study should they do while they're in high school to better help them get a head start in their nursing career?
I would absolutely say math and science, hands down, are the two areas that I would focus the most on, particularly being science. You'll definitely need your anatomy and physiology and chemistry courses that will take you down that path and be most helpful in college.
So if you're a high school student and you think this is the area you want to go, is there any options at St. Rita's that they can do shadowing or interning before they actually graduate from high school?
Absolutely. I would suggest enrolling in our volunteer program. We have plenty of opportunity through the volunteers. We take 14 all the way up to 18-year-olds. So you can start as early as the 8th grade all the way up to your senior. And there's plenty of opportunities to get on the nursing units and next to the patients where you'll be able to see and try it on for size if it fits for you.
Very good. So what's a good reason as to why you would want to work at Mercy Health St. Rita's in Lima? What do you see about this region that keeps you here for 17 years?
Hands down, the organization is a not-for-profit, faith-based organization, and we believe in extending the healing ministry of Jesus, and that's our mission of the hospital, and it extends throughout. It doesn't just hang on the walls, it extends throughout, walking in the halls. Every individual in that organization leads with that extending the healing ministry of Jesus. So that's what keeps me there. It aligns with my internal values and extends from each individual right down to the patient.
And I can certainly tell that when I walk through the halls as well. It is definitely evident. So if somebody wants to find out more about St. Rita's and about getting a job as a nurse, where can they go, Cory?
Mercy.com is our website, and so there are plenty of opportunities. I would offer, if you want to get your foot in the door, whether it's nursing or some other healthcare path, we have plenty of entry-level opportunities to begin that career. I have a lot of nurses who started out in transport, who started out in nutrition, who started out in EVS, just to kind of get the foot in the door, learn the hospital system, and they're some of our absolute highest performing nurses.
So what are some of the long-term benefits of someone working at Mercy Health? You've been there 17 years. I'm sure that there's longevity all throughout the staff. What's a long-term benefit?
I would think definitely the sense we absolutely have a lot of longevity as far as nurses, and I would say the number one benefit is the family hometown feel that you have. You don't get that in the big city. You don't get it in the Columbus. So we take the same types of patients. We have the same types of acuity, but we also have that hometown feel. It is a big family.
Very good. So as our high school students are listening to this conversation, is there anything else that you would like to tell them as they're looking into a field in the medical science?
If you have any inkling that that nursing or another healthcare field is for you, I would say find an opportunity to volunteer, to work as needed in another area in the hospital to see what fits for you.
Very good. Thank you, Cory. We certainly enjoyed having you.
All right. Thank you.